Big change for the USNS Comfort after growing criticism. The Navy hospital ship was supposed to help bring relief to New York hospitals, but very few beds have been being used. CBS 2's Alice Gaynor live now on the west side with more on this. Alice?
Christine, before, patients were brought to hospitals to be tested, to be evaluated, and if you tested negative, then you were brought here to the Comfort. Well, now the Comfort is taking on asymptomatic patients who have not yet been tested. They are isolating them and then testing them here. If you test positive for COVID-19, they'll bring you to the Javits Center. Otherwise, you'll be here, and they're hoping that this cuts down some steps and cuts down on the delays in bringing patients to the ship.
The USNS Comfort docked Monday with 1,000 beds available to treat non-coronavirus patients. Its intent to help free up space at the city's hard-hit hospitals. But days later, only about 20 patients were on board. Strict measures in place meant ambulances could not go straight to Comfort. They had to take a patient to a hospital first for evaluation and a test for the virus. Today, a change. The screening no longer requires a negative test. Now, a patient will have their temperature taken and answer a short questionnaire, peers side.
I don't have a doubt in my mind. The Comfort's going to be filled up soon. The Javits Center is going to be filled up soon.
With the Javits Center transforming into a COVID-only facility, many wonder why not Comfort. Military leaders and scientists have said it's risky to use a ship like Comfort in a viral environment due to the possibility of rapid spread.
The Navy's position is they don't want to put COVID people on the ship because it would be too hard to disinfect. They said that from day one, in fairness.
Yesterday, the Pentagon held a telephone briefing with Navy Captain Patrick Amersbach, commanding officer of the USNS Comfort, who says they follow orders from the Department of Defense, who's working with other federal agencies to make the calls.
We would, again, if we were directed to, potentially be able to take COVID-19 patients if we reconfigured the availability of beds on the ship based on the separation of COVID and non-COVID patients. But again, I really can't speculate on that at this point.
Now, the Pentagon gave a briefing a short time ago, once again saying it is risky to have a virus like that on board a ship here. They are looking at potentially maybe moving some doctors around as needed. As for how many patients are on board the USNS Comfort at this time, we were not given a set number, but we were told that it is more than 20. I also spoke with the CEO and president of Northwell Health earlier. He says the problem at his hospitals are that most patients have COVID-19 and cannot be brought here. We're live on the west side tonight. Alice Gaynor, CBS 2 News.